Okay, let's talk about one of the most frustrating questions in American life. Why does our healthcare cost so unbelievably much? For millions and millions of families, it is a constant, crushing financial strain. So where does all that money actually go? Come on, let's follow the money and see if we can figure this out. First, just to get a sense of the scale we're dealing with here. It's huge. For a typical American family that doesn't get subsidies from their job or the government, a mind-blowing 23 to 30% of their entire income can go to health insurance premiums, and that's before they've even seen a doctor or filled a single prescription. And to really put that into perspective, just look at this. When you stack it up against all the other big costs in life, healthcare is right up there with housing. It's a massive financial burden that just dwarfs what people spend on their cars, on food, on pretty much everything else. For so many people, it's literally like paying a second mortgage every single month. Which, brings us right to the big question. If families are pouring this much of their hard-earned money into the system, where is it all going? And I think for most of us, the first suspect that comes to mind? The insurance companies. But here's where the story gets a little weird. When we actually start digging into the insurance companies, we run into this really interesting paradox. It's not quite as simple as just blaming it all on corporate greed. So at first glance, this chart seems to let our main suspect right off the hook. Look at the profit margins. Health insurers are only making about 3%. That's nothing compared to the drug companies, and it's even less than the hospitals. So are the insurers really the problem? Well, it's a lot more complicated than that.
Because even though that margin, that percentage, is pretty small, the sheer amount of money flowing through the industry is just astronomical. That tiny little 3% slice translates into somewhere between $9 and $31 billion in pure profit every single year.
This quote right here just says it all, doesn't it? When the pie is over $1 trillion, even a tiny slice is a mountain of cash. So yeah, while their profit rate isn't outrageous, the total volume of money means the absolute profits are enormous. But even that doesn't explain the whole picture. So if the insurer's profit is just one piece of this giant, expensive puzzle, we've got to keep following the money. Where does the rest of it, the huge majority of your premium dollar, actually go? And it turns out there's a federal rule that actually points us in the right direction. It's called the Medical Loss Ratio, or MLR. Basically, this law forces insurance companies to spend at least 80 to 85 cents of every single dollar they take in on actual medical care. So what does that tell us? It tells us the real engine driving up our premiums isn't just insurer profit, it's the insane cost of the care itself.
So, who is setting these crazy high prices? Well, this table shows you just how messy and fragmented the whole system is. You've got private insurers trying to negotiate with giant hospital systems. You've got the government just setting its own prices for Medicare. Then you have these powerful middlemen called pharmacy benefit managers negotiating drug prices. And where are you, the individual, in all of this? You're at the bottom, with pretty much zero power to negotiate anything.
And this chaotic system creates the perfect storm for high prices. We have a fee-for-service model, which means doctors and hospitals get paid more for doing more stuff, not for making you healthier. Giant hospital chains have bought up all their competition, so they can charge whatever they want. And then you throw in sky-high drug prices and a mountain of administrative waste, and that's the real engine driving up costs for everyone.
Okay, so if we can all see what the problems are, why in the world is this system so hard to change? Well, the answer comes down to power and the immense amount of money spent to keep things exactly the way they are.
And when I say money, I mean a truly staggering amount. The entire healthcare industry, we're talking insurers, hospitals, drug companies, all of them, spends over $700 million a year. Lobbying politicians to protect the status quo and fight tooth and nail against any measures that would control costs.
This all creates this powerful one-two punch that just knocks out almost any attempt at reform. On one side, you have that massive, well-funded industry lobby pushing to protect their profits, and on the other side, you've got our own political gridlock, where deep divisions mean that even popular, common-sense ideas just go nowhere.
Now look, I know this all sounds pretty bleak, but it's not hopeless. There is a path forward. Policy experts from all over the political spectrum have actually identified some really clear, actionable ways to tackle the root causes of these high costs.
The roadmap to actually fixing this thing generally falls into 4 main buckets. First, we have to directly control the prices for care and for drugs, kind of like how most other developed countries do. Second, we need to boost competition and break up some of these healthcare monopolies. Third, we've got to change how we pay for care, rewarding doctors for keeping us healthy, not just for ordering more tests. And finally, we need way more transparency, so we can all see what things actually cost before we get the bill. And if you take away just one thing from all of this, let it be this. For decades, the political solution has always been to just throw more money at the problem, giving people subsidies to help them afford these insane prices. But pretty much all the experts agree that's just a band-aid. The only way to really fix the system for good is to go after the underlying prices themselves. So the crazy thing is, we actually have a pretty clear map for how to build a healthcare system that's more affordable and that actually works better. The real question isn't, what do we do? The real question is this. In a system with so much money and so much power working to stop any change, who has the political will to actually stand up and follow that map?